We have developed a resource in the form of a PowerPoint presentation. It is designed to educate nursing staff about the importance of oral hygiene. It will also provide valuable information which will improve the standard of oral care in the hospital setting. This is based on Recommendation 59 of the NICE Stroke Rehabilitation Guideline, which ensures that effective mouth care is given to people with difficulty swallowing after stroke in order to decrease the risk of aspiration pneumonia. The PowerPoint presentation will provide nursing staff with understanding of the following information: the importance of oral hygiene post-stroke, potential risks of poor oral care, and recommendations for basic oral care. This will be described in further detail later in our presentation. The implementation of this recommendation will assist a graduate speech pathologist in numerous ways. It will provide an opportunity to promote oral hygiene through educating fellow staff members. It will also provide a good opportunity for the new graduate to contribute to their healthcare team and to facilitate the lifelong learning of members of staff. This can establish the new graduate as a proactive member of the team, through them taking the initiative to provide access to information and encourage the standard of care to be consistent across the setting. In addition to the PowerPoint presentation, the introduction of portable oral hygiene kits would be beneficial. This would facilitate the ease of implementation with patients who have poor oral hygiene. For example, using the swabs dipped in mouthwash to remove oral residue. The kit items could include the following: a pen torch and a tongue depressor to inspect a patient's mouth, swabs to remove oral residue such as mucus or food particles, products such as biotine gels, mouthwashes and sprays to moisten and lubricate the oral cavity, paper towels to assist in removing oral residue, and disposable cups to dispose of sputum, etc. Our resource fits into the Adaptation to the Local Context section of the Knowledge to Action Process Framework. We have identified in the literature that after stroke, the risk of developing aspiration pneumonia is increased when oral hygiene is poor. This is due to bacteria entering the lungs carried by oral residue. The incidence of dysphagia after stroke has been stated to be between 23 and 50%. Combined with poor oral hygiene, this increases a patient's chance of developing aspiration pneumonia. Oral care training is therefore a priority for healthcare professionals, especially for nursing staff. We are in the process of adapting this to the local context for the introduction of education to nursing staff within the hospital setting. We will now share with you our PowerPoint presentation. Welcome nursing staff to our introductory course for oral hygiene. We hope you will all learn a great deal of information which you will find valuable so that you can implement oral care to your patients in practice. Today we will cover the importance of oral hygiene post-stroke, risks of poor oral hygiene, recommendations for basic oral care, followed by a short 10-question quiz to test your knowledge. It is important to place increased focus on good oral hygiene following stroke. People who have undergone stroke are often at a higher risk of developing poor oral health. Poor oral health can have negative effects on an individual following stroke, particularly for patients who are at high risk of aspirating oral secretions or have a reduced immune response. Adequate oral care can improve patient outcomes. Various factors can affect oral hygiene post-stroke. For example, reduced range of movement of oral structures, limiting the individual's ability to effectively maneuver food around their mouth and increase oral residue. Medications, particularly those which cause xerostomia or dry mouth, and facial palsy and decreased sensation which may lead to the patient being unaware of oral residue and therefore lack of clearance. Additionally, cognitive deficits, which leave the patient more reliant on carers. Carers may not receive appropriate training to adequately maintain oral care. Or xerostomia, which is dryness of the oral cavity, which may be caused by reduced saliva production, limiting the patient's ability to break down plaque and manipulate oral structures. This can compromise their ability to articulate clearly, manipulate food, clear oral residue, and increase the risk of infection in the oral cavity. This is also associated with pain and discomfort due to breaks and ulcers. It should be noted that each individual is likely to present in a different way following a stroke. Poor oral hygiene can increase the risk of the following. Aspiration pneumonia. This is when patients experiencing dysphagia or swallowing difficulties may aspirate oral residue, increasing the likelihood of the patient developing a chest infection. Aspiration pneumonia can increase the length of stay in hospital, increase mortality rate, and contribute to poorer patient outcomes. Oral residue can contribute to increased tooth decay, leading to dental caries. And bacterial imbalance in the oral cavity can lead to oral thrush. This may cause changes to taste, unpleasant odour, and decreased appetite. I will now hand you over to Min Lee, who will discuss the recommendations for good oral care.